8-year-old Asma is in a fight for her life. After fleeing violence in her home country of Sudan, the young refugee is now battling leukemia. But her fight to stay alive was made even more difficult when the United Nations Refugee Agency had to cut funding for her treatment, in part due to the United States government slashing foreign aid. She is among tens of thousands of refugees across Egypt that are facing a healthcare cliff. Her mom, Maha Musa Kafi, said the UN agency, up to this point, has been a godsend.
Truly, if I hadn't enrolled in the UNHCR, I don't know how I would have continued her treatment.
Kafi and Asma sought treatment in Egypt, while the husband stayed in Sudan and sent back money for the treatment. After the conflict erupted there in April 2023, Asma's father, Shara Ismail Musa, lost his job, and the family lost everything.
Where am I supposed to get the money from? How will I pay for this treatment? I work, but the money isn't enough for me to eat and pay for rent. I can't afford to pay for treatment, so where should I get it from? I don't have anyone here in Egypt. Shall I leave her without treatment? Of course it doesn't make sense, right?
The UNHCR reported that last year, it received less than 50% of the $135 million required to assist over 939,000 registered refugees and asylum seekers from Sudan and 60 other countries currently residing in Egypt. Alan Mena is UNHCR's public health chief.
From UNHCR-supported services, close to 13 million displaced people, including over 6 million children, are at risk of losing access to this life-saving treatment for health and nutrition services in 2025.
Aid cuts from several donors, including top donor the United States, as part of President Donald Trump's review of foreign aid, have triggered a cash flow crisis. The Geneva-based agency has frozen over $300 million in planned activities to save costs, and its chief has warned that millions of lives are at risk from what he called, quote, brutal funding cuts.